Do you have brain fog? Do you have chronic fatigue? Do you feel weak? I'm Dr. Lonnie Herman, and in this video, as in all of my other videos, I'm going to share with you some amazing findings that I discover in the kind of examination that I offer patients who suffer chronic illnesses who come into my clinic to help them reverse their chronic disease. In this examination on this patient, which is done July 14th of 2015, which is one of our follow-up examinations, I discovered what I believe is the core of why, the bottom line of why she still experiences some brain fog and some difficulty in concentration. Up to this point, she has had amazing recovery with neck pain relief, not 100% yet, but there's amazing recovery with neck pain relief and leg pain relief, and overall body flu-like symptoms have disappeared, and just about everything is completely fixed with her. Her memory is getting better, and now there's still a bit of brain fog and concentration difficulty. Not in the morning, but as the day progresses, she feels like her brain is not able to do as well as she expects it to. In this examination on this day, I discovered that her number one primary stressed tissue with my kind of unique bioresonance testing was her hemoglobin. Do you know what the hemoglobin is? Some of you may not who are watching this video. In any part of the world on the World Wide Web where you're watching this, you deserve to know about your body. Your body has cells called red blood cells and white blood cells of many different kinds of cells, and those red blood cells carry oxygen and nutrients to all of your tissues from head to toe. Your hemoglobin inside the red blood cell, the hemoglobin is the iron protein that attracts oxygen. Oxygen is stored in the hemoglobin of the red blood cell. Let me ask you this question. Could you just imagine that let's say that the hemoglobin is the master bedroom of the home or the condominium that you live in. And that master bedroom is only able to hold enough. Let's say we could duplicate you. There's enough of you. There's 20 of you in your master bedroom that's comfortable. Now let's just say that over the course of a few years of you living in that condominium or that home, that other people start to invade, other diseased people start to invade that master bedroom and don't give you enough room for you to exist in that master bedroom. Can you just imagine that scenario? Let's just play this storyline, that there's different disease that can actually get into that room that doesn't give you enough room to exist inside your master bedroom. You're actually gonna not fit in there too well. It's gonna be quite a strain for you to exist when it's overcrowded in that space. The hemoglobin can actually be invaded by infections and toxins. Toxins like heavy metals, like mercury, like lead, like arsenic, like cadmium, like pesticides, like residues from vaccines and antibiotics. These things can get into the red blood cell. How do they do that? I'll get into that in just a moment. You can also have parasitic infections and Lyme infection and viral infection and all kinds of things that can get into your hemoglobin, crowd its space, and not allow enough oxygen to exist in that red blood cell. What happens on a blood test? If you were to check your red blood cell and your hemoglobin level, maybe, just maybe, it fits into what the lab range of low to high of a normal, what they consider within normal limits. Maybe it just fits at the low end of normal, or maybe just above the low end of normal. But for you as an individual, maybe that hemoglobin test is not accurate for how you are supposed to function at an A+ optimal level. Just imagine that for you, your passing grade in a class was let's say that your school or your school that your children go to, the lowest passing grade is supposed to be a C. Let's say with 70 to 100. Let's say that they allow your child or you to pass the class with a 63, which would be a very low D average. And they say, no, it's okay, you can just pass. Well, some of these blood laboratory ranges are just like that. It's not, you can only pass with a 90 to a 100. So for your body to function as you expect, and your brain to function as you expect, you want to function at an A+ level. You want to have perfect function and brain function. You don't want diseased brain. You don't want diseased body. You want normal brain and body function and energy and clarity of thought and memory and everything. What if the laboratory range allows you to have a passing grade at a 63, so to speak? So what if your hemoglobin, your oxygen containing part of your red blood cell, gets a passing grade according to what the lab range is of whoever made up that laboratory range? That doesn't mean they made it up for you. They made it up as a broad spectrum of what they allow to fit into a passing grade, by the way. Your hemoglobin range may be way above what they consider what a low normal is. Is this making sense? Hopefully that analogy does. Because you need to have as high a level as possible of oxygen inside that blood cell. So when things crowd the space of that red blood cell and that hemoglobin, and this has been proven, parasites can enter the red blood cell. Infections and toxins can be on and in the red blood cell. Immune system attacks do take place against your own red blood cell. That is totally possible, and it will not show up on a regular average red blood cell test. It won't show up. There are specific tests that can be run if your doctor is even ready to understand or has any clue about the other research that goes on in the world about how an immune attack against the red blood cell can take place and rob your brain, your bone, your heart, your intestines, your stomach's ability, your thyroid's ability to be able to function at normal level because there's not enough oxygen inside the hemoglobin. And further, there are many blood tests that I study where the hemoglobin is low, the red blood cell is low, but the iron level is normal, perfectly normal, and the hemoglobin and red blood cell count is still low. And the doctors remain baffled. Well, here I'm going to share with you in this video about the findings of this one patient who still experiences some brain fog and some difficulty in memory, although she's dramatically better than what she was when she first walked in here. One day she will do a testimonial video to share her story with you. In her hemoglobin, I found a very high level of Lyme Borrelia burgdorferi infection. That Borrelia burgdorferi is a smart critter, and it can invade the red blood cell. There is research that I put into another video that shows that there are certain substances that exist in beans and nuts, peanut butter. You can have these substances because of eating certain parts of your diet that can invade the red blood cell and strip the protective fatty layer, also known as the lipid layer, that circles around that blood cell. Just imagine that you're a soldier going into battle with an armored suit on you to protect you in battle. And somebody comes up to you and throws this acid on your body that dissolves the armor. You have no more protection. Your red blood cell can actually have this armor dissolved from certain ingredients or substances that are part of. There are enzymes and acids that exist in nuts and seeds and beans that can and will, over time, destroy, without a pesticide, they can and will destroy the red blood cell protective coating, also known as a lipid layer. Now, the Borrelia has a very easy way. This Lyme bug can easily get into the red blood cell and infect the red blood cell and cause a lack of oxygen. Why? Because that infection can crowd the space and not allow enough oxygen to exist inside the cell. Is that making sense? The next topic, the next substance I found inside her hemoglobin, invading that hemoglobin, is her dental amalgam. She already had the mercury removed from her mouth, and there still is mercury inside the red blood cell. There is a preservative, that's a cancer-causing preservative, that also invaded her hemoglobin. It's called BHT. This BHT preservative is found in some common childhood cereals. So even if she's eating natural organic products now or for the past 10 years, what about 12 years ago, 15 years ago, 20 years ago, where these preservatives were in the food that she was eating? It's in the blood cell. We've got to get it out of there, and with my work, we're doing just that. She has two kinds of Candida infection in that blood cell. She has a Candida glabrata and Candida krusei. These infections are inside her hemoglobin, crowding its space, not allowing enough oxygen to exist inside that cell. So what about when that red blood cell, which carries these infections and toxins that I've listed so far, and there's more to list here, what happens when that red blood cell carries these infections, not only carrying iron or a vitamin or a mineral and oxygen, what about when it's carrying less than normal oxygen and these toxins and infections up to the brain or to the bone marrow or to the thyroid gland? What about that? Or to the cerebellum of the brain? What about that? What do you think is happening to those tissues? Do you think those tissues are bathing in the perfect essence of life, or are they getting sicker and sicker and sicker? And the doctors are prescribing medication after medication after medication, instead of finding the triggers for these infections, these diseases, these malfunctions in the human body. I also found X-ray radiation affecting that hemoglobin. She had multiple parasitic infections in that hemoglobin. She has multiple antibiotic residues. Even if you took them one time as a child, or you took them, or your parents took you to the doctor, to the pediatrician every week or every month because of chronic fevers and ear infections and tonsil infections and so on, the antibiotic residue is in her hemoglobin, and it's from many years ago that she took antibiotics, and she took a lot of antibiotics. And for this, if you have Lyme infection and you're listening to this and you have your doctors, you're taking these so-called Lyme literate MDs and Lyme literate NDs, and they're prescribing you boatloads of antibiotics for months and years, you've got to know that those antibiotics can get into your bone, can get into your blood cell and disease the blood cell. Wherever that blood goes, it's carrying that toxic residue. She's got another kind of bacterial infection in there. She's got tobacco smoke. She used to be a tobacco smoker. Well, there is residue of tobacco smoke inside the hemoglobin, crowding its space. There's tobacco toxins inside the hemoglobin, crowding its space. There are pesticides inside the hemoglobin, not allowing that red blood cell and hemoglobin to function the way her brain needs it to. Do you know your brain requires two kinds of fuel? Oxygen is one, sugar is the other. What happens when the brain can't get enough oxygen? We have deficiency in function. Malfunctions develop. She has mycoplasma bacteria inside her hemoglobin. For her, those were, on this day, all of the infections and toxins I could find in that hemoglobin. I sent her home with specific remedies that will remove these infections and toxins from her hemoglobin. That doesn't mean it's going to remove it from an organ somewhere, but it's going to remove it from the blood supply to the organ, to the gland, to the bone, to the lymph, to the brain. So does that mean it's cleaning up all the system? No, but it's getting right into that blood cell, which feeds your cells, which feeds your brain and your bone. We're going to clean out that cell. So now it's not bringing disease to the tissues. Is this making sense to you? I sure hope it does, because for you to be able to help yourself, for you to help yourself fix your chronic disease, for you to help yourself get your chronic fatigue to go away, for you to help yourself to get your dementia, your Alzheimer's, for you to help yourself to stop these chronic ailments, cancers even, because cancer is in love with a low oxygen environment. What happens when hemoglobin is low in the red blood cell because it's infected, because it's invaded with toxins and infections? You're not getting enough oxygen to your tissue. Cancer will thrive in that environment. Don't be fooled. Don't be fooled. Breathing in oxygen through a machine is not going to fix it. You've got to be able to get to the core of the red blood cell and remove the toxins and infections if they do exist there, if this is part of your complication. I see this patient in 2 weeks, and I expect to see, I really do expect to see a nice dramatic change with the way that she's functioning. And I will report to you more about her development, about her improvement, about her progress, as I do in all these other videos of patients who I take care of. You deserve to get well. Click subscribe on my YouTube channel. I share videos all the time. Be the first to find out about them. Share this video with just one friend who you know who suffers from some kind of ailment where they're not getting help from their doctors, of any kind of doctor that they're seeing. And there's some pretty expensive programs out there that are doing nothing more than injecting amino acids into tissues and doing glutathione and doing some saunas. You've got to find out where the core problems are coming from. And also look for me on my Facebook page, where I'm very active on there and I share a lot of information. Thank you for coming to my channel, watching this video. Thank you for sharing this time with me, and I look forward to helping you understand more and helping you get well. Call my clinic if you really want to take the next step and find out what's going on with your body and help yourself fix yourself. The number here is 954-370-3100. 954-370-3100, and call only if you are serious about reversing your chronic disease, whether it's lupus, it's Raynaud's phenomenon, where there's a blood vessel disorder, where there's a bone disease. You need to find out the cause, and I'm here to help you do it. Talk to you soon. Goodbye.